So this video will demonstrate prepping of an abdomen for abdominal surgery. Here we have one of the residents prepping for surgery. This could actually be completed by a circulating nurse or an anesthesia nurse, but in this scenario, it will be a resident who's going to be prepping the abdomen. She's going to take some blue towels and place it on the side to prevent any pooling of the prep solution. She's also going to place a third blue pad just across the patient's lap. She has the prep tray there, which is wrapped sterilely, and she has a choice of two different types of solutions, which is a chlorhexidine or providine. Here she's going to use the chlorhexidine. The patient doesn't have any allergies. Just going to open the sterile package. She's going to check the chlorhexidine solution to check for its expiry date. And she's going to pour the solution into the cup. She's going to be using a pair of sterile gloves to prep the abdomen. She has a package of sterile 4x4 gauze, which are non-radiopaque. So these sponges are non-radiopaque because they're actually going to be tossed into the garbage after prepping the abdomen. So these will not be included in your count. She's preparing all the sponges for easy application during prepping. So here they will be prepping the abdomen. So we're going to start off first with the umbilicus. So the resident has checked to make sure that the umbilicus is free of any dirt and lint or any other material, and she uses a Q-tip with an antiseptic to prep the area. Now she's using her first sponge to prep the incision. She starts from the incision line, working outward. From the incision line, her second sponge will then be used to prep from the incision and outwards towards the side of the patient, just above the arms, and upwards towards the xiphoids and downwards towards the symphysis pubis. Once this sponge is dry, she uses a second sponge to apply the antiseptic solution. So now she's covered the whole area. She used a chlorhexidine solution, therefore she needs to wait a minimum of 3 minutes for the solution to dry to prevent any fires intraoperatively, also to prevent any skin irritation to the patient. Once the 3 minutes is up, she will then remove the blue towels. Notice how she's removing it and being careful not to contaminate the prepped area. Okay. Now that the abdomen has been prepped, it's dried. Now it's ready for draping.